students, welcome to today's lecture. In our today's lecture, we are going to see introduction to posology and various factors affecting dose and action of drugs. So let's start with our today's video. First of all, we'll be seeing what is meant by posology. So posology is derived from a Greek word that is posos means how much and logos means science. It is a branch of medicine or pharmacy which deals with doses of the drug. Posology is the branch of medicinal science which deals with dose quantity of drug which can be administered to the patient to get the desired pharmacological action. Dose is the quantitative amount administered or taken by a patient for the intended medicinal effect. Remember students, the dose has to be taken in the therapeutic range because if the range exceeds, then it may show the toxic effect, and if the dose is taken less than the required therapeutic dose, then it is not going to produce any effect. Therefore, proper therapeutic dose is required in order to get the required pharmacological action. Now, moving to the factors which affect the drug dosage. So these factors include age, body weight, sex, then body surface area, time of administration, route of administration, frequency of administration, emotional factors, accumulation, environmental factor, presence of disease, additive effect, then idiosyncrasy. The next one is SYNERGISM, then TACHYPHYLAXIS. The next one is antagonism, tolerance. Then the next one is habituation or drug dependence and hypersensitivity. So let us look on all these factors one by one. The first one, that is age. Age of an individual is one of the important factor affecting the dose and the pharmacological action of drug. Age is concerned as capacity of metabolizing or excreting the drug from the body. In newborn or the infants has immature renal and hepatic functionings. Thus, they are much sensitive to the drugs as compared to that of children and adult, and therefore they require less dose. Whereas the elderly or old patients, due to aging and renal and hepatic dysfunctioning, may require less dose as compared to adult. Now moving to the next factor, that is body weight. So body weight of an individual is considered as a key factor on the theory that the concentration of the drug at its site of action will often be influenced by the size of the patient, and hence heavily built patient require larger dose than that of the normal patient. Usually 70 kg is considered as normal weight of adult patient, and therefore if the drug is to be given to an obese adult or lean adult, in that case the dose is needed to be adjusted. Okay, that is, the body weight has important role to play with the quantity of dose to be administered. Now moving to the next one, that is sex. Sex, either male or female, affects the dose of drug because of difference in the weight, then physique, and certain psychological phenomenon. Generally, a female requires 0.85% of the drug that is needed by male. Women are more susceptible to be affected or have effect of certain drugs than that of men. On the basis of body weight, female adults generally require smaller dose, as already said, around 0.85%. Pregnant women and lactating mothers should use medicines only on the advice and under the guidance of their physician. Some drugs like that of morphine, alcohol, barbiturates, etc., they transplantly get transmitted from mother to the fetus, and ultimately they may cause harm to the fetus. Therefore, it becomes very essential, very necessary to take into the consideration the sex before deciding the dose for women, especially in case of pregnancy and if they are mother. Now moving to next one, that is body surface area. A close relation exists between large number of physiological process and body surface area. Many physiological factors such as plasma volume, oxygen consumption, body electrolyte are proportional to the surface area. The surface area is used to calculate dose. Example, anti-cancer drug methotrexate is administered on mg per square mm of body surface. Average body surface area of a 70 kg adult is 1.7 to 1.8 square meters. The next factor is route of administration. So students, there are many routes of administration as you already know, like that of oral route, rectal route, parenteral route, etc. However, the particular route to be selected will depend on the severity of the disease. If the doctor wants rapid therapeutic action, he will select parenteral or IV route, right? Drug administered intravenously enters the blood system directly and thus the full amount administered is present in the blood. However, if drug is administered orally, are rarely fully absorbed due to the various physical, chemical and biologic barriers to their absorption, including interaction with gastric and intestinal content. Thus, the lesser parenteral dose of drug is required than that of oral dose to achieve same blood level of drug. So we can conclude that depending upon the route, dose of the drug can be decided. Now moving to next one, that is time of administration. Students, remember the time of administration of drug is also important as it influences the dosage of the drug. This is especially true for oral therapy in relation to that of meal. Absorption proceeds more rapidly if the stomach or the upper portion of the intestinal tract is free of food, that is when it is empty, and an amount of drug that is effective when taken before a meal may be ineffective if administered during or after eating. Sometimes drug given on empty stomach can cause irritation but can be tolerated when given after meal, right? Gastric emptying rate also affects the dose. Students, I will explain you this with the help of example. You know appetizers are given before meal, right? Whereas digestants are given after meal. Laxatives are given at night and purgatives are given in early morning. So these examples shows the importance of time of administration. Now moving to next one, that is frequency of administration. Drugs having short half-life gets rapidly excreted from the body. Therefore, in such cases to maintain steady state plasma concentration, it is required to have frequent dosing. Hence, controlled and sustained release formulations are developed. Then, the next factor is emotional factor. Females are generally more emotional as compared to that of males, and therefore certain medicines are required in less dosage in order to get the desired effect. The personality of the doctor may influence the patient for his early recovery. Such faith on the mind of patient may affect the efficiency of the dosage of drug. So this is an example of emotional factor. If the patient is motivated, he may get well soon, right? Because of his own emotional well-being or emotional faith. Now, the next factor is accumulation. So, accumulation of drug in the body is the result of slow excretion or defective degradation or unexpected rapid absorption of the drug. Such medication build up to toxic level in the body, resulting in toxic symptoms. For example, in case of digitalis, heavy metals, etc. So in that case, only maintenance dose of such drug should be continued and further accumulation should be avoided. Now, the next factor is environmental factor. Environmental factor also affects the dose of the drug. For example, stimulating medicines are more effective when taken during the day, whereas hypnotic drug, that is the drug which produces sleep, are less effective if taken during the day. Hypnotics are more effective when taken at night due to the fact that darkness is a sedative. The amount of barbiturate necessary to induce sleep during day is significantly higher than that needed at night. Therefore, the dose of the drug must be decided on the basis of environmental condition of the patient. Now, moving to next one, that is presence of disease. Higher doses of drugs can be tolerated in patient with diseased condition than in normal patient. Similarly, patients with hepatic and renal disturbances may not metabolize the drug properly and can result in drug accumulation, which means they need less dose, right? Because drug accumulation is a dangerous condition which may prove to be fatal, right? Therefore, the dose of the drug for diseased patient must be decided on the basis of condition of the patient and the type of disease he have, right? Then the next factor is additive effect. So additive effect is when the pharmacological action, or rather total pharmacological action of two or more drug administered together is equivalent to sum of their individual pharmacological action. It is called as additive effect. The next factor is idiosyncrasy. So it is defined as genetically determined abnormal or unusual response to a drug. In this, patient response to medication is distinct from the pharmacological effect. For example, small dose of aspirin may cause gastric hemorrhages in certain population. The actual mechanism is not known. However, in few cases, it is explained on the basis of genetically determined total absence or reduced activity of some enzyme in the body of the person. In such cases, the drug should be immediately discontinued. Moving to the next factor. So next factor is synergism. So here, when two drugs or more than two drugs are given together, the result in total is greater in comparison to that of sum of their independent or individual response. So that is called as synergism. That is, the potency is increased in comparison to that of their individual response. Then the next factor is tachyphylaxis. So when certain drugs are administered repeatedly at short interval, the cell receptor gets blocked and pharmacological response to that particular drug is decreased. The decreased response cannot be reversed even after increasing the dose. The drugs like epinephrine, then cocaine, they can produce this condition. However, if the drug is discontinued for a longer time, then the initial effect of the drug can reappear. Then, moving to the next factor, that is antagonism. When action of one drug is opposed by the other drug on the same physiological system, it is known as antagonism. Or we can say that when the action or duration of action of one drug is diminished by another drug, the phenomenon is called as antagonism. Getting, for example, milk of magnesia when given in acid poisoning, at that time the effect or the poisoning effect is retarded. Getting, then the next is tolerance. Tolerance is the condition when a usually large dose is required to produce an effect which can be done normally by a normal dose. It is due to development of drug resistance which demands larger dose. For example, smokers can tolerate nicotine. This tolerance is of two types. The first one is true tolerance and pseudo tolerance. So true tolerance is produced by oral and parenteral administration of drug, whereas pseudo tolerance is produced only to the oral route of administration. In true tolerance, the receptor of the drugs are decreased, but in case of pseudo tolerance, receptors are alive, but absorption of drug is decreased and or excretion is increased. Then the development of tolerance can be minimized by first, that is initiating therapy with the lowest effective dose, or by avoiding prolonged administration. Then the next factor is habituation or drug dependence. Habituation is a condition when the patient continues to be under emotional or psychological dependence rather than compulsion. For example, tea, coffee, right? So these things are not, they do not create any compulsion. Individual can carry out his work even in absence of such agent. Therefore, there is no physical dependence, hence the condition can be controlled and tackled. The next is hypersensitivity. So hypersensitivity or drug allergy is the adverse effect to a particular chemical resulting from the previous exposure to the substance. This condition appears in only a small fraction of people receiving the particular drug. This type of behavior can be due to frequent use of drugs like that of antibiotics, vitamins, or some proteinous substances. So thank you students. Here we are to summarize the things we studied in this video. We have studied what is posology, then we have seen the factors affecting such as age, body weight, sex, route of administration, time of administration, frequency of administration, right, disease condition or presence of disease, environmental factor, emotional factor. Then we have also seen accumulation. Then we have seen antagonism, addiction, right, hypersensitivity, tolerance, etc. I hope you have understood these factors, how they influence dose and action of drug in human beings. So thank you for watching till end.